Okay. Hi, my name's Aubri. I'm a person who happens to use drugs. I started using drugs when I was 18. Within a couple years, I had a $200 or $300 a day habit. I used mainly by myself. I had a lot of abscesses. My doctor at one point thought I was going to die from endocarditis. I was coming in every few weeks because I was using in bathrooms like the folks we saw in this film. Dirty bathrooms. I was injecting in between rotaries outside in dirt using toilet water. Eventually my doctor started treating me with harm reduction, and one doctor prescribed saline water. I thought that was amazing. Like, wow, I can have clean water. Am I really a decent person to be able to be treated like that? So I know that for myself, I was always very cautious about overdosing because I lost so many folks along the way. I always had 911 dialed on my phone before I used and was ready to press the button. Often had one hand near the phone in case I needed to. I did a couple times. Fortunately, it wasn't necessary. I had to tell them, you know, I'm good, see you later. But that's really not a solution. When you're out, you're out. And there is no way to press that call button. I lost a lot of friends to overdoses. I also saved a lot of lives. I was a peer-to-peer harm reductionist. I carried Narcan. I still do carry Narcan, syringes, works on me everywhere I go. Make sure my peers have access to the life-saving things that are necessary. And I was really lucky that I had some great harm reductionists in my life that showed me how to stay safe. And I truly believe that if it wasn't for the harm reductionists that I met along the way, that I would not be sitting here today. I believe harm reduction saved my life, and I had a chance to leave problematic drug use behind me because I survived. A lot of my peers have not. I think part of the problem is that there's so much shame and stigma in talking about drug use and people identifying as a drug user that people isolate. And they isolate their use, they isolate themselves. Isolated selves and isolated use often leads to accidental overdose, as we're seeing in Massachusetts. So like I said, I have lost a lot of friends to overdoses, many in front of my eyes. A lot of the times there was not enough Narcan or there wasn't enough time. It's a hard thing to watch this movie today, honestly. It brings back a lot of names and a lot of faces for me. But there's still time to change. And that's what we're here for tonight, I think, is to change and move on to tomorrow and next week and next year. I think I want to make an important point. The 1st and the 3rd of the month are coming up this weekend. Keep an eye on your peers, keep an eye on your friends, keep an eye on your neighbors, because I know there's going to be people going out this weekend that we're not going to see on Tuesday and on Wednesday. And that can change if we had a SIF in Boston. So, thank you.
I'm not sure what I have to add to that. We have a small room, the only space available to us that's street level, that we just invite people in with no questions asked. We don't need a name even. And we basically monitor folks who are in some stage of overdose. They are typically already a little bit sedated and struggling to stay awake and say, used a little bit more than usual today. This is what I've taken. I'm nervous about that. Do you mind if I stay here? And they stay. And often we'll see kind of a progression in the level of central nervous system depression and sedation, even to a full coma. And then we're watching some pretty scary other physiologic signs that I think are reflective of a pretty complicated cocktail of substances being used. We intervene when we need to with supplemental oxygen and sometimes intravenous fluids to support blood pressures. We had a young man, 26 years old, who was a participant in SPOT several times, who eventually went into treatment, went into detox from heroin and eventually residential treatment, and had, I think, 6 or 7 weeks in total of abstinence from heroin under his belt when he was discharged from that system. And on the day that he was discharged, showed up at SPOT saying, look, I know that I'm going to relapse, and I'm looking for a buddy to come with me because I'm scared. I don't want to die. And so the folks in the room, none of the other participants that were there that day could really respond. Everyone was really sedated. No one really could walk or talk. And so there was no one to go with him. So we made sure that he had Narcan on him. We tried to suggest things like doing a test shot, made sure he understood that his tolerance was probably lower than it had been before. We hoped that he would go somewhere where he wouldn't be completely alone. And he died about an hour and a half after that, just a couple blocks from our building, which was, tragic and frustrating that we can't sort of extend the kind of services that we're providing, which is to, open our doors to people who are actively using drugs, who either don't want to or can't, for some reason, access treatment right now, so that they don't have to do this in private and in hiding. So I think, just when I look at the evidence behind supervised injection facilities that has been gathered from other parts of the country, it's a pretty robust base of research at this point, much of the research coming out of 2 programs, one in Vancouver and one in Sydney. When I look at that body of literature from a public health point of view, I think that there is no question that in the midst of the current epidemic, which, by the way, in Massachusetts, there are more lives lost every year now to overdose than there were in the height of the AIDS epidemic. And yet we are not responding the same way as a society. I'm absolutely convinced that we need to figure out how to reduce harm for people who are actively using. And I think that it needs to go beyond needle exchange, medical monitoring, Narcan. I think it needs to go, I think we absolutely should be implementing supervised injection at this point in Massachusetts. So I'll stop there.
So when people came into the facilities that I worked in 3 counties under 6 sheriffs over a 30-year period, I had to be concerned about their medical profile. If someone was a diabetic, I had to ensure that they had insulin, or I exposed myself to liability. Not true of a heroin addict. And I don't really see a big difference between the two when it comes down to the difference between crime, conduct, behavior, and medical condition. So folks, I want to tell you that I'm here tonight as a member of LEAP, which is an organization dedicated to the proposition that the drug war is a failure. And I'm a member of a growing number of current and former law enforcement officials who are standing up all over the country to talk about this. It's a medical condition, folks. And I wasn't qualified to deal with it. I would be listening to my radio in my cruiser, and I would be hearing calls to the police department for needles. Needles found next to the Walgreens, needles found in back of a parking lot, needles found all over the community. And the idea that the police department's function ought to be dedicated to cleaning up the needles and not doing what police were ordained to do, which is to protect people from predatory violence, is absurd. It's absolutely absurd. One case just before I retired was a Hep C case. And you can imagine that that person had an addiction history, because 70% of injectors are likely to be Hep C positive. And so when the health service administrator came to me and said, so-and-so is here, and the recommended course of treatment is going to be $25,000 a month, I said, excuse me, and I went out and got some water from the cooler and came back in. And I said, okay, can you repeat that, please? Was that $25,000 overall? No, it's $25,000 a month. Now, understand that in Massachusetts, we don't extend the mass health benefit to people who are incarcerated. Now, when you consider the fact that more than half of the population that I served in terms of correctional clients over a 30-year period have substance abuse and addiction issues, you can imagine what that does to a budget. Folks, the criminal justice system is just not aptly equipped to deal with a situation where someone is addicted to these substances. And then they come in and they're not using the substances and they're not on a maintenance regimen, and the treatment is there, but the treatment is not holistic medical public health treatment. And so tolerance wanes. They come out, they don't have a place to go. They make it to a place like Boston or any other city or any other town or any other hamlet, and they use and they overdose and they die. I was a corrections officer in Worcester County in the central part of the state, and I met a guy named Ernie, and he was in and out of the facility, and his criminality was driven by heroin addiction. Well, there were no injection facilities, clearly, where they could be safe and use clean needles in a supervised atmosphere. And Ernie was picked up from a work release program where he was assigned and brought back to our facility to be told that his HIV test came back positive. And so what the criminal justice system did, unwittingly as it may be, is punish the man for a medical condition from which he suffered. He maintained his medical condition, the use, with dirty needles. He was positive for HIV, and he lost his life. And I know that everybody in this room probably knows somebody that's been touched by this, and my fellow panelists spoke eloquently to this issue, but this is a real problem. This isn't something that we can turn around and ignore. This isn't something that we can pretend doesn't exist. When we had Prohibition, alcohol poisoning went up 600%. We're seeing the same thing. We don't know what's in the drug. We don't know what's going to happen when they inject it. As you heard from the movie and from the people here, you don't know what's going to happen if they don't know how to inject it. What is so wrong with providing a safe place in a supervised atmosphere for a person with a medical condition to inject, to seek resources, and to get the help they need? Thank you.
So if there's a stigma and if there's a shame, there will still be a problem. And I think we need to work to end that stigma and shame together as a coalition and work towards real harm reduction strategies that work and save lives.